Hello, I'm Cynthia. On the Leadership Skills Questionnaire, I scored 27 on administrative skills, 30 on interpersonal skills, and 27 on conceptual skills. The organization that I work for is kind of a mix between vertical and horizontal. I work in a health department. It's actually a group of 3 health departments for 3 counties: Rutherford, Polk, and McDowell, because we're really small counties as far as population goes. We have a medical director that is over all 3 health departments in all 3 counties. He's over everything, the medical part, environmental health, finance, personnel. He works closely with the Board of Health in all 3 communities. Then we have a director of nursing who is over all 3 counties. Each county has an adult health supervisor who is my supervisor and a child health supervisor. They're responsible for scheduling employees and scheduling the clinics and handling any problems or conflicts that arise. Then we are divided into departments that have coordinators. We have a coordinator of the STD and communicable diseases, the immunization coordinator, child health coordinator, family planning coordinator. There's a maternity case management coordinator, child care case manager coordinator, BSEPS coordinator, which is breast and cervical cancer prevention nurse, and maternal health, which is me, the maternal health coordinator. Then there are public health nurse staff. Most of them now are part-time nurses that come in and help us with our clinics. We also have interdisciplinary departments like management support, who take care of our charts, financial department, personnel department. We have Nurse Family Partnership, WIC, the IT. We have a lab department, which nurses staff it right now because we don't have a lab person. On clinic days, the coordinator of the program will direct and advise in that clinic. The other nurses from the other departments come in and we help work in all the different clinics, so we have to be trained in different skills. We also pull in some of the interdisciplinary professionals that work at the health department. We serve families, so if we see someone that comes in for immunizations for their children, and the mom hasn't had a physical in a while, we try to get her into BSEPS or family planning. If we see someone that is having problems with their nutrition with their children that comes in family planning, we may send them to the child health coordinators for their checkups. So we serve the whole family. So we work together in what would be called a transdisciplinary teamwork style, and that correlates with the article that I picked out about transdisciplinary teamwork. This article is actually about rehabilitating patients that's had orthopedic surgeries and that are rehabilitating from that, but it focuses on, it benefits patients more to have an interdisciplinary staff when they're recovering, and I believe the same thing in the public health. If I were to advance at my current job, it would probably be to the women's health supervisor. I don't want the job, but if I were to move up, that would be my next step. Some of the skills that I would need from Chapter 7 would be organizing, definitely, planning and coordinating. We plan all our clinics, our health fairs, our audits, recertification a year in advance. So it's vital for our supervisors and our directors of nursing to have a really good organizational plan and coordinate how all the nurses are going to keep up with our certifications, because we have to have a lot of certifications, and several of us have expanded roles so that we can work in different clinics. It is vital for our supervisors to coordinate with outside agencies that we refer our patients to. And also, we have to have good communication, because we can communicate with our state and regional liaisons that advise us on the proper policies and procedures and caring for the public in public health. The structure that I work in, horizontal, works well for us in this current environment. But if I had my choice, I would choose the vertical organizational structure. I've worked in that structure before in other organizations like hospital and home health as charge nurse and lead nurse, and I enjoyed it. I thought it worked well, having support from the assistant director of nursing and unit managers and the director of nursing. And I think that is all, and have a good weekend.